all know that the good nutrition is a foundation of good health. The word nutrition is derived from the word nutricus, which means to suckle at the breast. Breastfeeding is the foundation of life. Breastfeeding counseling should be started right during the antenatal visits so that the mother is more concentrated and focused on breastfeeding the newborn and should realize that this is a unique process that has no substitution. Why? Because breastfeeding has innumerable benefits for the baby and the mother itself. Colostrum, or the thick yellow milk in the beginning, is the first immunization of the infant. It should never be discarded thinking of it as a bad milk. It is rich in nutrients, it has antiviral activity which helps in immunity, growth and helps in passing the first stool. Prelacteal foods such as honey, water, etc. should never be given to a newborn. It can cause diarrhea and many life-threatening diseases. Mother milk is a complete food for the baby and it is usually digested, and composition of breast milk is best suited for the infants. It is always present in normal temperature, hence no temperature adjustment is required. It is economic, there is no wastage, and it is a renewable resource. Child develops a sense of security and the child's and the mother's bonding strengthens in this process. And the child grows up to become a healthy adult with high IQ, less likely to fall ill. As the infant works hard to extract the milk from the breast, her jaws get fully developed and there is less of infection or contamination, as there is no handling process in the breast milk, or there is no chances of overfeed or underfeed. Now, breastfeeding is not only important for the child, it has enormous benefits for the mother also. For example, it helps decrease postpartum bleeding and returns the uterus to its normal shape, sheds the extra weight that is gained during pregnancy, and also helps in birth control. No special arrangement is required for breastfeeding. Risk of cancer and type 2 diabetes mellitus reduces. The bone density of the mother increases. Sense of satisfaction develops in the mother. The special hormones that are required in this process are released in large amounts, and you can breastfeed in and during any illness. Now, when and how to breastfeed? Mothers should start breastfeeding within half an hour of normal delivery, and if the mother is a C-section, then the breastfeeding can be started within 4 hours. For how long? Exclusive breastfeeding should be started from 0 to 6 months. From 6 months to 2 years, breastfeeding should be continued with complementary feeding. And how to breastfeed? There are several positions, among which these 4 positions can be followed. The one is football hold, cradle position, sideline position and laid back position. The baby's head and the whole body should be close to the mother. The face and the stomach of the body should be towards the mother's body. Ear and shoulder should be in straight line. How do you understand that the baby is feeding nicely and there is good attachment with the mother? The mouth should cover the most of the area of the areolar. Areolar is the dark part of the nipple, with some areolar visible outside the mouth. The mouth should be wide open. The chin should touch the breast and the lower lip should be turned outwards. This picture represents good attachment with the mother, and this picture represents poor attachment. Typically, mothers can breastfeed 8 to 10 times in 24 hours, and please do not hold the milk inside the breast for long durations. It can lead to complications. You can always use breast pumps and do feed the child with breast milk exclusively for the 6 months, and do not give anything else, because breast milk is the nature's best gift to a newborn. Thank you.